Continuing the slew of mass layoffs in another drastic move that has sent shockwaves through the United States health sector, the Trump administration has initiated a massive restructuring within the US Department of Health and Human Services, the HHS, resulting in layoffs of 10,000 employees across multiple federal health agencies. On Tuesday morning, hundreds of federal health workers arrived at their offices only to be denied entry, learning on the spot that they had been dismissed from their positions. The sweeping job cuts affect some of the nation's most critical health organizations, including the U.S. Food and Drug Administration, that's the FDA, the Centers for Disease Control and Prevention, that's the CDC, and the National Institutes of Health, that is the NIH. The restructuring is part of a broader government overhaul spearheaded by POTUS and billionaire entrepreneur Elon Musk under the Department of Government Efficiency (DOGE), aimed at streamlining U.S. federal operations and reducing spending. U.S. Health Secretary Robert F. Kennedy Jr. had previously announced the downsizing, detailing that the U.S. HHS workforce would be reduced from 82,000 to 62,000 through a combination of layoffs and voluntary departures. Kennedy stated the move is intended to allow the department to refocus its effort on preventing chronic diseases and improving overall healthcare efficiency. In a post on X, Kennedy wrote, and I quote, "Our hearts go out to those who have lost their jobs, but the reality is clear. What we have been doing isn't working. This restructuring is necessary to create a health department that truly prioritizes disease prevention and efficient healthcare delivery." According to the White House, the job cuts will significantly affect high-profile agencies. The FDA is set to lose 3,500 full-time employees. The CDC will see 2,400 of its workers dismissed, and the NIH is cutting 1,200 positions. These cuts come at a crucial time when public health officials are still grappling with emerging health threats, including the ongoing response to avian influenza. In fact, a Reuters report has confirmed that some of the laid-off FDA staff were directly involved in efforts to combat bird flu. The layoffs, which were communicated as early as 5 a.m. EDT on Tuesday, caught many employees off guard. Reports indicate that workers received electronic notifications of their terminations before they could even enter their office buildings. With thousands of highly skilled federal health workers now out of jobs, questions loom about the long-term impact of this restructuring. Will these layoffs lead to increased efficiency, as the administration claims, or will they weaken the nation's ability to respond to public health crisis? As the dust settles, one thing is clear: the US health sector is entering an era of profound change, and the full consequences of these mass layoffs are yet to be seen.